why medics should be entrepreneurs and innovators. First, there are 10 members in the audience, and I'm going to take a photograph. I want to take that photograph. And this is what we are going to change. In 2 years' time, we need 2,000 attendees to this session. This is where we start on this topic. The purpose of this session to highlight the critical need for medical professionals to collaborate with medical technology developers and startups from an early stage. And we believe this collaboration will help the scientific community develop better solutions for global challenges, including antimicrobial resistance. And I'm Dr. Abdul Ghafur, I'm an infectious diseases consultant at Apollo Chennai, and we have Taslimarif, he's a CEO of CCAMP joining online. We have got Geetanjali Radhakrishnan, she's a CEO of Adiyuvo Diagnostics in Chennai. And we have Sachin Dubey, he's a CEO of Module Innovations from Delhi. Sushmita Sunder, you know her, rich Hyderabad, Telangana. Sanu Anand, he's the strategy growth leader, cloud physician from Bangalore. And Suneetha Nareddy, my colleague, infectious disease consultant from Apollo, Hyderabad. And we have got Dr. Reddy, you all know him. I will ask the question to Sachin. Taslim joined? Okay, I'll ask the question to Sachin. Sachin, why do you believe doctors should be a part of medical technology startup?
So first of all, I think thank you, Dr. Ghafur, for this opportunity and G-SPARC for bringing together this wonderful session. I would sort of date back that how we started this company, what exactly was, very briefly, that what we do. So we are building diagnostics for urinary tract infection point of care diagnosis, which does identify the bacteria at the point of care. Now, we are engineers, we know the tech very well, but of course we are very much overwhelmed by what we are trying to build. But those who are actually going to use the product is something like the input that they provide is very, very critical. So right from the start of the company, we had this very important and pertinent thought in mind that if we want to build something for the user, we should have their input very well. So at many times, we got several key inputs, like the initial version was a 30-minute diagnostic test, but the clinician, like we have one doctor who is part of our team as well. So he told that the interaction time and the patient load in India is very high. So if you are building something of 30-minute time frame and you say that it is point of care, why ye nahi chalega? So those are the kind of inputs that were very critical. And then we transform the technology such that it now does the diagnosis in 5 minutes, which is right when the patient and doctor are interacting. So just at that point of time, you can get the output. So I think it is very critical to receive those very important inputs right when the product is being developed, rather than completely changing the product when it has been developed and then you start to take the input. So I think that's my input on this.
Thank you, Sachin, because Sachin has developed a rapid point of care UTI diagnostic. And Sachin believes we doctors are the end users of the device. And if we are involved early on, we can develop, the medtech engineers can develop better technology, more efficient technology. Good morning, Taslim. We are talking about what advantage it brings to the innovation field if medics are involved early on in the medtech development. Sachin, Taslim, 1 minute, we'll increase the voice of the speaker. Please increase the voice of the speaker. Okay now? Yeah, good. Taslim, carry on.
Yeah, no, good morning. I partially heard your question. If you don't mind repeating, Dr. Ghafur.
Taslim, what is the advantage for having medics as partners in medtech innovation startup?
Absolutely. First, thank you, organizers. Thank you, Dr. Ghafur, for having me here. I'm delighted to be here, and my apologies because of reasons I couldn't be there in person, but delighted to join. I think in general, I think in form of the building healthcare solutions as entrepreneurs build it, and the momentum that is being built, I think it is very important to see that the final practitioners who actually understand and who are the part or the core of the decision making in terms of delivery of healthcare, that is doctors along with the support system that they have, they are the key in terms of eyes and ears in a broader setup, in terms of what actually is needed on the ground. They are the ones who understand the contextual needs on the ground. They are the ones who understand in this geography, in this setting, in these circumstances, what kind of solutions are needed. And they are the ones who actually see the plus and minuses of the system, plus and minus of the current solutions, and the limitations per se. I think they are the ones who have the pulse, if I may use I think the same, of the system and the needs of the system. And I think it is very vital. And we have seen one after another strong cases where doctors, the medics who are part of this in terms of building healthcare solutions, they are the ones who actually keep the entire thing on the right, very tight path. And that is the strength that they bring on it. They understand the need in terms of the healthcare delivery, the circumstances, the context, and they help the innovator in a way. If they are not the innovator themselves, by the way, innovators, if the main point of the aim, they actually help the innovator to be on the right path, not only at the concept level during development and even post-market launch. The very role that they play, and I think we've seen multiple times, the teams which have the medics on the roll, they are able to add strong capability. I'll stop here, but I think it's a very valid point and something that we strongly encourage at CCAM for them to have that in the founding team. And
thank you, Taslim. Taslim stressed the point. Medics should be part of the medtech startups. And CCAMP is doing a wonderful example of that, how they involve medics and biotech engineers to encourage startups to product wonderful products. Dr. Reddy, all the medtech engineers are stressing, they want us to be part of medtech startups. But what is preventing us being part of medtech startups?
A very interesting question. I think, first thing is, as doctors, most of the times we feel that we are gods. The gods don't do the business. I think, that is the, just being more serious. The biggest problem is there is no ecosystem available in order to even think in the direction of becoming entrepreneurs. Because if you are a doctor, traditionally, especially in India, that you have a secure job. Your job is going to give you whatever comforts you want. So most of the doctors, they don't want to push that boundary and go into terra incognita. Because any entrepreneurship, it is a risk. And most of us are risk averse. Innovation is nothing but jumping into a sea without knowing the depth. And we don't want to do that. I think, that is the first thing which prevents most of the doctors to think in that direction. Second is those who are on the bench side, those who are with money bags, they usually consider doctors as some sect involving whom they will invariably face a longer journey to reach their goals. Because what happens is most of the times, because we have learned a lot of things, we always try and look at the downside rather than the upside. For example, if we are treating a patient, first and foremost, do no harm is our principle, right? And we come from that perspective saying that, in this, is there any risk, right? We try and time and again tell actually the other partners what is the risk, which usually, I'm sorry using the word, pisses off to no extent. This is what I have seen. I have worked with, I think, both in Europe and here and also North America, mentoring about 100 plus organizations. And most of the times they keep saying, Doc, please, don't tell the negative things. Tell us, the positive thing. So that actually is also downside. So there is a saying that knowledge is a curse sometimes. This extra knowledge, sometimes we don't know how to channelize and how to articulate in order to make this venture going and becoming into the track. So that is the second thing. Third most important thing is the regulatory framework, especially in India, does not allow the doctors to think in that direction because there is no funding available. There is no regulatory framework which is kind of amenable to think in that direction. So doctors keep, I know, at least 50 doctors, even within actually Telangana, who have done some or the other innovation. They don't know how to patent it. They don't know how to convert that into a product or a service. And there is no ecosystem, neither from the government or the private sector, which can help them. There are incubators. I'm sorry, if I'm going to make anybody unhappy, but they are inverted commas. They are incubators by name, but in reality, it is very difficult actually to get some kind of hand-holding to take through this journey of idea into a product or service. I will stop here. Thank you very much.
Dr. Reddy summarized all the challenges. First, we doctors are so comfortable in our day-to-day life. We have our stable income. Yes, of course. Of course, yes.
Thank you, Ghafur, for that question. So, I would like to tell a story of Dr. Paul Brandt. Dr. Paul Brandt was a surgeon, but before he became a surgeon, he was a carpenter. He used his carpentry skills in developing surgeries for people with leprosy to overcome their difficulty of peripheral neuropathy resultant damages to the foot. The same technologies are being used for diabetic-related neuropathy and diabetic-related foot damage and so on. So you need skill sets of different specialties to come up with innovation. When you're a doctor, you're so focused on treating a particular problem. The more specialized you get, you know more of that particular but less of anything else. So that you don't think outside the box. And that the route to that starts in our schooling. When we go to school from morning to evening, come back, go for tuitions, and start cramming up everything so that we get enough scores in the 12th grade and then take the entrance exams and get into med school. You don't know anything beyond the textbook. You know the theory, you don't know the practicalities. You don't know what to do when you go into the kitchen and how to cook, which is actually a chemical reaction. When you play, you develop other skills, like sports physicians are best, players become best sports physicians. You need to have a well-rounded curriculum growing up. You study physics, chemistry, and biology. Most states don't even need math to become a doctor. You don't need commerce. But if you have a well-grounded, previously we had 1 year of degree before you did MBBS. Now we don't have that. A well-rounded education which could include some time for internship in other areas or education in other areas other than the core can help a long way in terms of you having developed some skill sets to work in areas like research or entrepreneurship or innovator. You need to have dedicated time to be able to do stuff other than what is your core subject. Or when you're working, if you're working in an institution or a private sector, you don't have any dedicated time to do anything other than patient care. You need some dedicated time where you will be able to do something outside patient care. Protected time, which is lacking. Innovations come when you think outside the box and when you interact with other specialties. Engineering working with medicine brings up innovations. Here you're working with your own cocoon and you don't see anything outside. That's one of the challenges.
Yeah, Suneetha stressed a very important point. We doctors don't think out of the box. Our only idea of collaboration is infectious disease collaboration with cardiologists, cardiologists collaborate with nephrologists. That's our idea of collaboration. So we need a paradigm shift in the perspective of the medical community. Dr. Sushmita, if doctors are willing to get involved, you want them early on or later stage as an advisor? What do you prefer?
Thank you, Dr. Ghafur, for this question, and thank you, Dr. Ranga Reddy, for inviting me to this event. So, a little bit of past. I did my PhD in National University of Singapore, and I was fortunate enough to be part of a program called Singapore Stanford Biodesign. This is a program which brings in multidisciplinary group, engineers, doctors, management students, scientists, hardware makers, mechanical engineers to address a medical problem. And that was my first close encounter. I was a biomedical engineering student working on tissue engineering, developing a material for corneal replacement. And that was my first time encountering going inside into an operation theater in Singapore Eye Research Institute and developing a tool for their vitreoretinal surgery. And that interaction between engineering and doctor changed my perspective that for any innovation to develop in the medical field, a doctor should be involved right from the ideation time. And we were fortunate enough to develop the product. We were fortunate enough to patent it. And we were second-year PhD students. We couldn't take it forward. And it was not because the doctor's problem statement was not right. The technology didn't exist. We were trying to miniaturize ultrasound technology for the eye application, and miniaturizing ultrasound at that scale was not available way back 15 years back. So even though engineers can address medical problems, there has to be a back and forth iteration. There has to be a constant discussion between medics. The problem might be right, engineers need their technology. So there is a lot of involvement of tech and engineering with the healthcare professionals. Moving on, 5 years I worked at ISB, and that's where I realized it's not just tech, medic, for healthcare innovations, but also the business angle, the sustainability angle to it. Oftentimes, why healthcare innovations fail is because they do not meet the third lens, which is management, which is sustainability in terms of a business value proposition. So it is very important to have these three parameters right from the ideation stage. It's not, as rightly pointed out, after you develop the product, I'll go talk with the healthcare professional, who is the user, who is the consumer. It has to come from the beginning. So little deviation to that question. So I currently head the life sciences vertical at RICH, Research and Innovation Circle of Hyderabad. And it's been 2 years journey with RICH. And I work with a lot of medical devices, diagnostics, and digital health startups. I must say it's a challenge to bring both clinician side, engineering side, and the business angle conversations happening in Hyderabad. We do this annual event called ABCs of Medical Devices, Diagnostics, and Digital Health Commercialization Journey. And it is always scary. Should I book a room with a capacity of 100 people? Should I book a room with capacity of 50? Because I'm not sure how many of them will turn up. Both startups are excited. Startups are willing to showcase. But will the clinicians, as promised, come? Is it their priority to be part of this conversation? So we've been trying many interventions to convince them. We don't tell them just become a founder or an entrepreneur to begin with. Explore the ecosystem first. Be an advisor. Be a co-founder. And then see if you can be part of the founding team. Or at least if you can start by little investment as well, of your time, of your expertise. And that's where we are taking our efforts. I must say this journey has been fruitful. Small steps. We've been able to work with 20 plus hospitals in the last 2 years. We've been able to work with at least 35 plus doctors. Small journey, but we are open to explore more. And as Dr. Ranga Reddy pointed out, yes, there are a lot of doctors with patents sitting with them, not knowing how to commercialize, how to help them.
Thank you, Sushmita. Sushmita summarized all the challenges they face and how reluctant doctors are to be part of, or at least listening to the wonderful technology our medtech innovators develop. It's a real challenge. I'll ask the questions to Geeta. Geeta once discussed in detail with me what challenges she faced in taking doctors on board. Geeta, would you please summarize the challenges you face?
Sure. First of all, thanks, and it's a pleasure being here. Thanks for the invite. So I don't want to make anybody uncomfortable over here, but the real challenge is when I first founded the company, I got the problem statement of understanding microbiome in wound care directly from a dermatologist, right? And there are very few doctors in the community who think beyond treating patients. They actually want to do something innovative that can actually save their time. India is a country where each doctor has to cater to a number of patients and the time is limited. You have to follow a lot of protocols in terms of you have to ensure that you've taken their history, you need to document each of that, and you have very limited time. And this particular doctor wanted to save the time, and he wanted a device that could help him understand bacteria or fungus at the point of care without sending it for a culture or a gram staining. Now that's how I started, working on this particular problem statement and developed a non-invasive device. Though I was pretty convinced the dermatologist is pretty happy about it, once we had a prototype or a minimum viable product, it took a very long time in terms of understanding and making doctors accept a new product that can help them see infections, just with a click of a button, just by taking an image. Now, some of the challenges have been, you have to cater to a variety of specialists who comes with great skill sets, some being plastic surgeons, vascular surgeons who have gone through a lot of training in understanding infections. Now, when you come with a new product, right, which is still, when you look at it at a novelty scale, it's the first ever in the entire world, and we have so many patents supporting it, we have so many organizations looking at it, but still the doctors feel that their training is more than enough to look at it, and such a tool may not be necessary. What challenge mainly I face is there is a lot of unknown that they miss. So even now, when we work with, I would call it as innovative doctors, they try to see what are the unknowns that they discover using our device, which they wouldn't have known with their regular training, right? Now, that is the kind of change that, that's a problem that we face, and which is also why we need medics to be involved in the startup journey early on. We are not specialists. The doctors are going to treat the doctor. We are just going to aid them better. We have the skill set in software, in hardware, embedded systems, AI, right? But the doctors are the one with the knowledge about what is the patient going through, right? And if we have such a collaboration early on, the medics would be able to further interact with other medics in a much more easier language that they understand. Like, we're not trying to replace doctors, but rather, come up with solutions in India made for the Indian population. And that challenge is something that we still face, and we want the doctors to seriously understand that we have huge potential. It's just that, there should be a sense of innovation and unknown and constant learning. If they can understand, that would really be helpful.
Geeta spoke from her heart, and we doctors heard that. This is what innovators like Geeta want from the medics. They want us to be part of their entrepreneurial journey from an early stage. We have Sanu Anand. He's a doctor. He's an intensivist. And Sanu and friends founded a company called Cloud Physician. It provides telemedicine services. And it's a big company. I knew that recently Sanu got 10 million investment for his company. That means it's not a small startup anymore. Sanu, being a doctor, what inspired you to be an innovator and entrepreneur?
Yeah. So I heard a lot about, doctors not wanting to be innovators, doctors not wanting to be XYZ because of a lot of challenges. It's the ecosystem, and all the points are correct. And as somebody who has actually moved over to the dark side, let me just give you a hint of my journey. It was in 2017, I think, when I joined Cloud Physician. And the reason why I did that was I kind of reached a plateau where I started doing things in critical care. I'm an intensivist by qualification. And when I thought about my life 20 years down the line, it looked pretty much the same. Same procedures, same patients, maybe a few extra things will come, a little more salary, less night shifts. It looked the same. And when I asked myself, do I want to be here? The answer was no. And then when I was on my way to another country, I met these guys, my founders of Cloud Physician, Dr. Dilip and Dhruv, who moved from the US, from Cleveland Clinic, and started this organization. And at that point in time, when I told my friends, my family was supportive, of course, my friends and colleagues, the unanimous answer I got was, you're crazy. Like, why would you want to do something like this? You have a set job, you have a bright future abroad, this. And I said to myself, I can always go back to what I was doing. This doesn't work. So perhaps one thing that all of us need to ask ourselves when you even decide to embark on not just an entrepreneurial journey, anything out of the box, what's the worst case scenario? No doctor in this country is going to go hungry. You will have a job. You go back to what you're doing. If something doesn't work, just go back to what you're doing. So when I had that answer, I was like, okay, fine, let me try this. Doesn't work, I can always go back to being an intensivist and earn whatever I was earning. That's how it started. And when I asked my family, they're like, yeah, you found your tribe, go. You're a crazy guy, just anyway. So that's where it started. And from there on, the journey, I mean, pretty much all the points have been covered, but from a practical aspect, the reason why doctors need to be involved is, like many of us rightly said here, we have context and we have deep domain expertise. So many organizations, technology organizations and hospital chains, etc., have been trying to dabble with telemedicine in this country, particularly the tele-ICU space. It didn't work out for some, for many reasons, many reasons, particularly the tech companies, the large giants. They came in, they made the hospital spend 80, 90 lakhs, hardwired all the equipment, put technology in place there, and now all these doctors we have been talking about, they walk in and they find this technology very clunky. It's not user-friendly. To put a paracetamol order, I have to go through 9 clicks. So this is what happened. They didn't involve a doctor when they were developing the tech. So now the hospital has spent 80 lakhs on putting all these fancy monitors and software, and nobody is using it. And we go to tier 2, tier 3, they don't even have these 80, 90 lakhs. They don't even have 10 lakhs to invest on hardware. And we're talking about integrated software to put a central nursing system in an ICU. We don't have, we have one monitor is made in America, one is made in Mysore, one is made in China. There's no way to wire all these things. So we had to come up with frugal solutions which specifically address the Indian context. So then we looked at our tech team and told them, hey, you develop an AI algorithm which can look at any monitor of any make and directly chart vitals onto my tech platform, Radar. And they did that. So now we don't need connected HL7 compliant monitors. My camera can look at any monitor anywhere in the country, and we have stationed this in about 250 hospitals in 3 countries. And we have developed that software in conjunction with physicians and intensivists and all other specialists who work full-time. And even when we developed the electronic medical record platform, we sat with the tech team and told them, hey, I need this, I need this, I need my Corte bundle in place here, I need my vitals to come, I need my trend line to come like this, I need a AI tool to actually quickly write notes. And they developed a artificial intelligence program called IRA. At a click of a button now my system can write a 1-page note for me, because typically you go at the bedside, pulse is this much, BP is this much, GCS is this much. All this is already there in your nursing note. You're wasting your time. So we developed an AI tool to kind of mitigate this. Now our efficiency of note writing is improved by 40%. Similarly, nurses are sitting and charting intake, output, that, this. All this could be made easier with technology. But the key point is there were clinicians to tell these guys that these are the problems that we have at the bedside, and this is what we'll solve. That was point A. Now, then the business team sits together, and I'm going to invest these many man hours of my tech team here. What is the return of investment on this? Now the return of investment is 40% reduced manpower time. So that's that much more time for nurses and doctors to do other things. So there was a business case to make there as well. Otherwise, most of the doctors, sorry, I'm taking a little extra time, but one of the problems that we doctors face is when it comes to innovation or giving out ideas, we go into these altruistic sinkholes. All of us have these, very passionate things we have held on for our entire lifetime. And when somebody comes, hey, I want a problem, solution for this problem. And whose problem is it? Yeah, it is my problem. But we don't look at how niche it is and how ubiquitous it is too. So for example, if I come up with a solution to read ECGs, and in fact there is an organization which does that at scale and very successfully as well. But from an impact standpoint, it's ubiquitous, but it is not niche and it is low value. ECMO on the other hand, it is very niche, but it is not ubiquitous. It's high value. It doesn't really, swing both ways. Whereas if I talk about ventilators, which is my expertise, it is ubiquitous, it is niche, and it is high value. Now people are willing to put their weight behind this. So we're working on solutions where I can read, ventilator waveforms and directly my platform can give an answer as to what's happening with the patient. So ventilators are there in every part of the world, every part of the country. So finding solutions which are ubiquitous, niche, high value, finding solutions which will give you a return of investment, and also most importantly get people excited about being a part of the team. So that's been my journey. And last but not the least, one of the biggest problems India has is we don't have doctors to look up to when it comes to entrepreneurial journeys like the US or many other European countries. There are very few doctors who have been successful in their entrepreneurial journey outside that of a hospital environment. So we need more of those, not the demigods like a Devi Shetty or Dr. Pratap Reddy, but people who are sitting next to you,
right,
who have succeeded in doing something. So perhaps this is a start. I can see the room filling up.
Right, Sanu, right. Sanu being an intensive care physician, he and team knows the challenges they face. They know the problem and they found the solution. That's advantage. If those who understand the problem try to find solution, you can have better solution. That's why Sanu and team are able to progress very fast. If you have the same kind of collaboration with medics and medtech engineers, we can develop better solutions, faster solutions, and that can be, while deployed, the acceptance by the medical community will be far better. Here the acceptance is better because the users develop the solution. That's what we want. That's the level of collaboration we want. Sachin, now, if you would have had medical collaborators as your co-founders from early on, what difference would have had in your journey? And you are going to deploy your technology in the vast Indian and global medical community. What difference it would have made if you had doctors on board from the day one?
So, like a few months back, I was pitching to investors in the Bay Area, and there were some other teams as well, some other companies as well. So, when I met their team, it was like there are 3 doctors already who were heads of many other large hospitals in the US. So, right at that face value, the impression of that company from the investor's perspective changes. Versus somebody who is an engineer not having a clinician directly in the team. Maybe as part of the product development journey, we've involved a lot of doctors, but if somebody maybe who is a clinician and into that particular area goes with you and pitches in front of the investor, that is a very, very strong message that this is a technology which is actually something which is needed. So I think definitely it adds a lot of value. Not only I think from the start, but throughout the product development journey is what I feel the role of doctors is very, very important. So in our case as well, like when we were developing this product for urinary tract infection diagnosis, again, time was something which came up. We as engineers felt like we are reducing the time. We don't need to do a culture. We have reduced the time from 24 days to 30 minutes. But even that was something which was not the right fit. So those kind of inputs were very, very, very critical. Also, I think when the technology is presented or pitched to investors, of course, for scale and everything, we do need money. But it eventually also goes to a lot of doctors who are part or associated with those investors. So they get to be vetted by them, like those doctors themselves. So having somebody who is, again, part of that larger journey product use as part of your team really, really shows up very strongly.
So medtech engineers believe they can develop better technology if doctors are on board, and even better investment opportunities if doctors are on board. And Dr. Reddy and Suneetha explained our challenges. We are so comfortable with our daily clinical life. We are not trained, we are not taught in medical colleges how to be innovators, entrepreneurs. We doctors don't take risks. That's why we are trained. We follow algorithms, we follow guidelines, we follow check mark, and we are trained to mitigate risk. That's our core medical practice. And entrepreneurship is not mitigating risk. It's jumping into the ocean of risk. And that's why we need a change. Dr. Reddy, how can we... Suneetha. Yes.
I want to add one more point. See, whether you develop a kit for urine cultures, faster urine cultures, or whether you develop some other technology for microbiome. One of the challenges when it comes to the clinician's table and you say that, okay, doctor, please use this technology, the doctor will ask, okay, what do I know about this? Is it there in the journals? Are there peer-reviewed articles? Are there randomized control trials? This is the way that you look at it. Whereas if the doctors are involved from the beginning, the acceptance of the technology will be a little bit better from the doctor's standpoint of view. And the other challenge is getting approval from the
hospital.
Not just hospital, from the government. Any technology that comes in, unless it's government approved, doctors will be scared to even touch that. Regulatory bodies. Because the implications of using technology that is not approved will be huge when it comes to the court. On what basis have you used this? So for all of these reasons, again, you need to involve the doctors from the get-go, because then you can do more and more trials, which will help with the regulatory body.
Right. That's a very important point.
If I can just add one point quickly to that. So what we did, like we based out of Pune, so we involved like Sassoon Hospital, which is a government hospital, doctors from there throughout the product journey. So if a doctor communicates to doctor about the use of that product or relevance of that product, it's a very strong message versus me as an engineer talking. So we sort of devised that, okay, we worked with somebody who's very known face or known name in that community. We convinced him first, and then the rest part of convincing the other community, we sort of backed him that you do that part. So I think that was something which worked for us.
Because we doctors have got devices and drugs which have undergone randomized controlled trial. And so why our attitude is, perspective is, so why should we spend time on devices developed by small Indian startups with a limited evidence, 50 patients, 100 patients, where we have devices where randomized controlled trials of thousands of patients, drugs, thousands of patients randomized controlled trial. That's the other perspective. So if you are early on, we will not ask this question to the technology startups. We are part of it, we understand it, and when we doctors are part of it, other doctors will believe us. The medical community will believe us. Dr. Reddy, you are a senior figure in the world, and we know that we need to make a change. But how can we make that change? Where should we start?
Well, my journey post graduation had been a zigzag, almost like a roller coaster. I had been on three sides of actually the triad, a doctor, an entrepreneur, which is working on socially relevant areas, and of course an academician teaching at various universities. So during this period, since I had a little helicopter view, what I understood, especially if we are talking about the global south, with a special accent on India, the efforts like what you are doing, Dr. Ghafur, need to be intensified. We need to kind of get a big group of these doctors who already have turned into entrepreneurs. And we need to come and speak to more doctors, enthuse them in order to, kind of remove from their minds the kind of anxiety to move from their 9-to-5 hospital job, becoming entrepreneurs. I think we need to build a few role models. Even if some of them are going to be a little, overstated, it doesn't matter. But we need to actually promote a few doctors who already have made the baby steps in that direction. We need to make them as the role models so that, the people can look at them and say, if this guy could do, I can also do. That probably confidence we need to infuse, especially in the younger generation. Because forget about actually 35 plus, you can't change anything in their minds mostly. That is the behavioral science. But if you are going to actually catch them young and at, let's say, graduation, post-graduation level, at senior intern level, I think they just need actually a little stoke to move in that direction. So my suggestion to you, Dr. Ghafur, you already have taken a big initiative, and you need to probably involve more of these young people who are below 30, below 35, who have got a lot of aspirations, who have got a lot of ideas, and who have the risk-taking ability, right, going ahead. I think they need to be stoked. That way we can create a big group of people who are going to work for the good of the people, good of the nation. Thank you.
Thank you, Dr. Reddy. Dr. Reddy's suggestion is very valid suggestion. Catch the medics young, catch the medtech engineers young, make them work together. That is the way forward. Suneetha, should our medical education, MBBS or MD or after that, I never read a word innovation. I never read a word entrepreneurship in any of the medical textbooks. I don't know, nowadays I don't read textbooks, but when I studied, that word was not in any of the medical textbooks. Should we change it? And if we want to change it, how can we make this change happen?
So like I was telling earlier, you need to have a core curriculum whatever graduation do, be it medicine or engineering or anything, you have to have a core curriculum. Beyond that, 20% or whatever fixed amount of time should be earmarked in the curriculum to do something that is not related to that curriculum. It can be innovation, it can be entrepreneur, whatever, research or business strategies, or you have to do stuff that is away from the core curriculum. As a doctor, you don't study anything about computers. Even Microsoft Word or Excel will be difficult for most students graduating out of MBBS. So pick up whatever you like. That will make you think outside the core curriculum and will make you work eventually in curriculum in areas that is not necessarily related to medicine. That will merge different areas. So curriculum should be there. Beyond that, you have to have some amount of time to do something unrelated to that. And hospitals, say, be it universities, medical colleges, private corporate hospitals, anywhere. If the hospitals understand that there is more to patient care, earmark X amount of time for them to, paid time for them to do something out of their clinical work. Mandate that you have to do something and show whatever report you have. It may not necessarily have a profitable outcome, but you have to do something outside of your clinical patient care. That will definitely help people work not just in entrepreneurship, whatever areas that you want to work in. It may be in social welfare, it may be in public health, infection control, anything that you want to do.
Right. So first we need big work to do with the Medical Council, NMC. We need a curriculum change for undergraduate, postgraduates in all specialties. And then we need to talk to the government hospitals, private hospital. We need doctors to have dedicated time to be a part of startup entrepreneurship. It doesn't have to be theirs. They can collaborate with medtech and entrepreneurs. Big hospitals, groups can benefit a lot if their doctors work with engineers to develop technology. They can patent it. It could be a big commercial entrepreneurial opportunity for the big even corporate hospital. Or big IITs are doing it. IITs have got, they encourage spin-off. Recently I visited IIT Chennai. What an amazing setup they have. A teaching institution. And they are now going to start a medical school. IISc is doing the same thing in Bangalore. Starting a medical school. So the collaboration between scientists, engineers and medics are early on. Sushmita, we have got excellent incubators in the country. IITs have incubators now. AIMS have got an incubator. Why can't all the medical schools in the country have incubators? How can the scientific and the medtech infrastructure help the medical schools in setting up such incubators?
Valid question. And in Hyderabad itself, we have pockets of incubators in hospitals. So LVPI is one classic example in Hyderabad. They have an incubator, LVPI Bionest Incubator, which works exclusively on eye care related incubation, but also on other specializations as well. And again, AIG Hospital is also coming up with their own incubator. And so there are pockets of incubators in the hospitals which have taken up clinical research to encourage their doctors to have interaction with on the startups, to understand the innovation process, to understand the commercialization process. When it comes to medical colleges, one good initiative that I was part of is from Reddy Health City. Reddy has a medical college. They have engineering, management school, allied sciences, dental college, pharmacy, and the whole ecosystem, which can spur innovations in medical devices, digital health, and diagnostics. The institute has taken up one initiative under DST, where they are encouraging women dental students to think about entrepreneurship. So we did a course with them to a span of 35 days to inculcate in them the mindset to look beyond. I totally agree with Dr. Suneetha. You need to look beyond your profession. There are pieces where there is very interdisciplinary approaches happening. Things are happening again within BIRAC as well. There is a program called BIRAC SPARC, where incubators are funded to encourage innovators to have interaction in the hospital setting. So they did two themes, one in nutrition, the other one in mother and child healthcare. So seeds are being sown. In a country as big as India, it takes time. But proactively as well, there are a lot of clinicians who are showing interest. So we are there. Healthcare Bionest incubators are the best place. BIRAC has funded several early stage innovators through their BIG grant, 50 lakhs. It's a good seed amount to start your innovation in the space of healthcare products and services. So we are there, we have started the journey, but a lot can be done. So, yeah.
Sanu, so we have NMC curriculum change, medical schools have incubators, but entrepreneurial journey is a dedicated journey. You have to spend your life deep into that startup, will we doctors have time to, yes, we can be advisors. I have advisors to multiple startups. I have the time to do that. But I don't have the time to have a deep involvement in any of the startups. That need a lot of dedication. So even if we start a fellowship in medical entrepreneurship, and doctors or a PhD or MD in that, and if doctors complete that, a part of the entrepreneurial journey, even if we fail, as entrepreneurs we may fail, but don't you think it could be an experience for us? And if so, how can we utilize that experience in later part of curriculum or our career?
Yeah, absolutely. So, the first thing to really know is just like medicine itself is not for everybody. In 12th standard, there is a filtering. Within medicine, entrepreneurial journey or innovation, it's not for everybody. But for those who are inclined and interested, creating an ecosystem becomes very important. And not just that, when everybody else also goes through that ecosystem, you learn a lot of skills, particularly life skills. And it can be something, like Dr. Suneetha was mentioning, you learn Microsoft Excel, you can manage your home and, budget better. It starts there, it can be a simple, perks of learning entrepreneurship, simple perks of learning what a profit and loss exercise looks like, a simple understanding of what is return of investment. To just give you an example, during COVID, we were managing about 35 plus large government institutions, plus another 50 odd private hospitals at that time. And everybody wanted to buy ventilators. And I walked into the civil hospital in Ladakh, and there are 60 ventilators lying in a room. And there's not one doctor in that hospital who has the expertise to use that ventilator. So the next time I was on a call with, one of the district commissioners in one district, and he had about 20 lakhs lying around, and somebody was like, okay, let's buy some.
Time is up now.
Okay, I'll quickly finish. So just initiating this journey of entrepreneurship gives people skills, or gives everybody skills that they can learn from, and people who are particularly inclined towards entrepreneurship, they get the first stepping stone. From there, they'll know where to look for.
Right. So it's good to have an entrepreneurial experience. It's up to you to follow the entrepreneurial journey, but that experience, the training will help you in your future career, whether you are a doctor or an administrator or whatever you do. Geeta, is this your first live panel discussion with medics you are attending?
Yeah.
We had an online earlier. This is
Yes.
live. How do you think sessions like this in all medical societies conferences and all the engineering you can invite medics, we can invite engineers. How do you think such sessions will help our startup community ecosystem in the country?
Yeah, to put it very short, it's very refreshing to see that my fellow panelists who've been big in infection control actually talking about innovation. There are very few forums like this where entrepreneurs get to interact face-to-face with medical community professionals. This is very important because startups don't know where to look for, okay? They have the skill set, but they don't have the skill set to look for doctors who are KOLs in this field, who can actually bring about the policy change, right? Who can actually bring in the mass adoption of newer technologies. So such sessions are very much needed because it also brings awareness to be it doctors, be it nurses, everybody can be part of newer products, newer innovations. We don't need to import technologies. We have our own homegrown innovators over here. All we need to do is have a very healthy environment where we are not looking at each other as rivals, but rather a community that's going to bring about healthcare change and a big impact. And India is a large country where you can bring the impact, right? And I'm sure we have all kind of data sets which no one has. Like, look at our ethnicity, look at our background, look at our so much of difference that we all have in terms of the patient community we present. Bringing about, we have all the ancient medicine, we have the new medicine, and there are doctors who practice both. And this is the wonderful panel. Like when you get to such kind of panel, we get to understand each other. Understand the differences, also be motivated to move forward together. Yeah.
Thank you, Geeta. G-SPARC is the first medical conference in the country to organize a comprehensive panel discussion on how medics can collaborate with medtech engineers. And this, we want this to be a beginning. We want every medical conference to do the same. In 2 years' time, we need a perspective change, a big change in the medical community in our country. And that can help our country along. 80% of the medical devices in our country are imported. And we have a wonderful...